Good evening, everyone, and welcome to another episode of Excuse Me, Doctor. I am your host, Dr. Mel, and thank you for joining us tonight live for this kickoff of another wonderful week that we are going to create for ourselves. And at Excuse Me, Doctor, we are here every Monday to bring you health topics based on science so you can be confident and empowered when it comes to making decisions for you your family, hopefully yourself, and you are the same person, your family, and your community. We're here to clarify speculation, clear up misinformation, and debunk disinformation. So if you're joining us on YouTube and Facebook, thanks so much for tuning in. Please be sure to hit subscribe on YouTube and like on Facebook. Now, you might know that we were supposed to be on vacation. But there is so much popping off in the world of COVID that we just felt we had to come to you tonight because there's just so much to discuss. So thanks for tuning in. Make sure you start to write your questions in the chat because we are going to be covering a whole lot of ground tonight about all the developments that have been happening this week around COVID-19. And I just have to specifically thank my wonderful producers who mobilized from vacation, probably on the beach somewhere, at a moment's notice to join me tonight. So thank you so much to Lila Mays and Wayne Bruce. Thank you for being here in the house with me tonight.
Dr. Mel.
Hey. We definitely mobilized.
Mobilized. Dr. Mel, we're supposed to be on vacation.
Right. We just finished joking. This should be the cocktail show because we're supposed to be on vacation. We'd be just drinking and talking.
What's happening?
But anyway, we're gonna keep it serious because we talk about serious stuff.
Yeah, it's gonna look a little different tonight, y'all. You know, we normally all fired up with visuals and everything, but it's gonna look a little different because we on vacation.
Yeah, and we're just gonna have a relaxed conversation tonight and talk about everything that's happening, including the vaccine being approved today, the Pfizer vaccine being approved today, just to kick it off.
Wow.
Did y'all hear about that?
Yeah, how could we not? How could we not come back today when that happened? How could we not have a show when the FDA approved the Pfizer vaccine? Yes, big deal.
Yeah.
So what do y'all think that folks who've been saying they're not gonna take it because it's experimental? You think this is gonna move the needle on them?
I don't.
Not at all.
Yeah.
So, well, no, go ahead, Wayne.
I just don't think. I think people will use any excuse they can. I mean, not to take it because they're either they're afraid or they buy into some of the myths that are out there. So
right,
now the new thing is going to be they approved it too fast.
Right.
Yeah.
They approved it too fast.
You're probably right. But you know what's going to happen though is, as a result of approval, there's going to be a whole cascade of institutions that are going to start approving it or mandating it rather for people. I mean, it's already started today. The military is going to be requiring it. United Airlines announced that its employees are going to have to show proof of vaccination.
Wow.
Oregon, the state of Oregon is saying all state workers have to get vaccinated. And then there are just a ton of universities that are mandating that people have to get it. Did y'all hear what happened at UVA?
Yeah.
I didn't.
They sent a lot of kids home. How many kids did they send home, Dr.
Almost
Mel?
like 300. Almost 300 kids who did not comply with their vaccine mandate at UVA got sent home.
Oh.
Wow.
Yeah. So my concern is that, we're going to see more mandates, which I'm not against. But for those people who use, the civil liberties argument, they're going to double down because they're going to feel that they're more and more encroached on, as opposed to making the decision on their own to get vaccinated. Whereas on the opposite side, I think, 5% of the country who said, I'll get vaccinated if it's mandated, will go ahead and do it gladly, or maybe gladly is not the word, but they'll do it if it's mandated. And 5% of the country is a lot of people. So
that's a lot of people.
Yeah.
It is.
Yeah.
Okay. Well, we shall see.
We shall see.
I think it is huge story and significant that we got FDA approval. I think that's a victory.
Yeah, I think so too. I think, it's I think going to be important. First of all, it's important to know that it was approved based upon 44,000 individuals in the clinical trial from Pfizer that's been tracked in the EU, Turkey, South Africa, South America, and here in the United States. It showed that the vaccine was 91% effective in preventing cases of COVID. That was a slight drop from when it was authorized last December. At that point, it was 95% effective, but they're saying that they were just able to follow up more people over time. And overall, it averaged out to be 91% effective in preventing in preventing COVID, symptoms of COVID.
Yeah. So, Dr. Mel, did they test that with the Delta variant involved? Did that?
No, they actually submitted their data 78 days ago. So that was before the Delta variant became very prevalent here and probably in the EU. Now, South Africa has always had the South African variant. South America has had the Lambda variant. So presumably they did have some testing against those variants, during that surveillance period.
Look, COVID 2021 is not COVID 2020. It's
not even COVID.
Time.
It's not COVID-19 or
it ain't COVID-19.
20.
I mean, this is a whole nother beast.
Well,
basically.
and just to be clear about what y'all are talking about, COVID-19 doesn't mean there were 19 COVIDs before. It means COVID 2019. And so when you're joking and saying, yeah, this is COVID 2021, it's like COVID 21 is because now we're seeing these new strains of the virus pop up as a result of changes because it's infected so many millions of people. And these variations have arisen that have given it an advantage to be able to infect people more easily and be more easily transmitted from person to person, and possibly even make younger people sicker, which is what we're seeing with the Delta variant.
Okay.
Did you all see that video I sent you? It's an animation of the COVID vaccine where there's a needle being shot into the arm, and then the little guy goes into the body. He gets in there, and then he puts on the COVID costume, right? So he's like, "Hey, I'm COVID. Wake up! Look at me! Fight me! Fight me! Fight me!" And then they fight him. Cells. They fight him. And then
I didn't.
Did you
But
see
what
that?
happens
They
after
kill
that?
him. So then he dies. But then the actual COVID comes, and the cells are like, "Oh, you're familiar. You were that guy with the costume on." And they do the same thing. It's really an interesting animation of how the vaccine works.
Yeah, that is actually good, right? That's
cool.
exactly what's going on. Yeah.
So go ahead.
Well, the vaccine sends in, some kind of replica, in this case, of COVID. In this case, the instructions for how to make the spike protein, and it's telling your body, "Hey, look at me over here. I don't belong here. Make some antibodies against me. Fight me off." And so now that it's primed, you have these antibodies on the ready. This security force on the ready that is specifically trained to recognize the COVID spike protein the next time it comes in the form of actual COVID infection. And so they're ready to go. They don't need to be woken up.
Right. So they're already woke.
They're already woke. Right.
It's a vacation show, y'all. You will get some jokes in here. So look, I'm just it's funny because I'm looking at the comments, and as we talk about the vaccine approval, there are a lot of people. Well, they're not a lot of people. A lot of people are glad it got approved, but there's some people who think it may be an infringement on their rights. So, actually, do we want to go to comments now? It's a vacation show.
Sure, why not?
Yeah.
We can
Yeah.
take the comments.
Let's go to the comments.
Yeah, this is an interactive vacation
This is
show.
gonna be interactive. You know, Kwame Pettis said, I don't know what it's going to take for people to get the shot. Thanks for the information. Rev Jackson, I hope I'm pronouncing your name right. I think it's infringement on my rights. I should say what I put in my system. I watched my mom after getting it, having back-to-back small strokes. And then Yvonne, our favorite Yvonne Z. Smith
Well,
says,
before we get to our favorite Yvonne, Lorraine, I am sorry to hear about your mom having strokes. I don't know if the vaccine caused it. There's a chance that it did not, because, you know, strokes unfortunately happen, and I hope that she's had a full recovery. I understand what you say about infringement. The approval of the vaccine doesn't mean that you have to take it. It's only if there's certain circumstances, like if you want to work for a certain employer, that you would have to take it, or if you want to go to a certain school, that you would have to take it. And even so, there will be religious exemptions, and medical exceptions, such as if you are allergic to the ingredients of the vaccine. So there will be exceptions that will be made for those mandates for those employers and schools that choose to mandate now that they have the backing of the approval process.
I think that's hugely important. People are not going to just be walking around shooting folks up with the vaccine.
People in the arm. So I think people buy into some of the hype of it's going to be like Nazi. Yeah, they have made this thing the villain of the century. I mean, I don't know any other thing that's been this villainous. So how about this? So I heard this on a radio show tonight. Remember when Viagra was approved? People didn't care.
It was made by Pfizer.
If you had ED, you ain't care.
If you didn't have
even
ED,
if you didn't have ED,
if you didn't have ED, if you were just trying,
if you didn't care what was in that thing,
you didn't care. People was having heart attacks, and they still didn't care.
Right.
People had heart attacks.
Thing
they
about,
didn't care.
You know, if you had any underlying heart disease, don't take it. People are still popping it left and right. I took care of many of people who had heart attacks after taking Viagra because they shouldn't have been taking it in the first place, or passed out after taking Viagra because the blood left their brain, so to speak.
Same energy, y'all. Same energy.
Have that energy. Have that energy, because I mean, people took it. Young people took it. Young men took it.
Yeah, recreationally.
Black market.
Off the market, right. All of that.
They ain't care.
Remember our plumber, Wayne?
Yes, I do. So we had a plumber who didn't want to get paid in cash. He wanted to get paid from Dr. Mel.
In Viagra pills?
In Viagra.
Yeah.
In a prescription?
We paid him money. We did not pay
him. I know you paid him.
Oh, you know you.
Just want that to be clear.
You paid him.
Let's be clear. That one
there. Be up here.
Hold on, I should say that one there is going to pay him money. She is totally above board.
Yeah.
Totally above board. But yeah, so.
But you know, there's been no social media campaign. There was not a social media campaign against Viagra like there is against this vaccine, even though the same company manufactured both things. And, you know, the information that's being brought to bear against the vaccine around myths and disinformation is being weaponized against our community. So we know that the same Russian bots and trolls that influenced the 2016 election, I've said it before, the University of Maryland has done excellent research to show that that same mechanism has been used to pump misinformation into communities that have suffered historic trauma and don't trust the medical system. And they know that those seeds will just be in that fertile ground of distrust and will grow like wildfire, which is essentially what's happened. And so the very communities that need the vaccine the most because they have the highest rates of death from COVID are the same communities that are not taking the vaccine. And if there was ever a conspiracy, I don't know what qualifies more as a conspiracy than that you are able to successfully mount a disinformation campaign to
Right.
persuade people that need the vaccine the most from not taking it.
And there you have it.
That was a mouthful. I'm sorry.
And
I'm tickled because people were like, if there's something that can fix this situation,
they didn't care.
they didn't care. So were people telling them to drink, take sea moss, and go sit in the sun and eat oranges to make the thing work? No.
Right,
I know
exactly.
brothers right now with cases of sea moss. Right now. Organic sea moss. Organic sea moss and Irish moss if they were Jamaican.
And listen, that's all great. Do what you can to supplement
to boost
and
your health.
enhance
Absolutely.
your health. Right.
But it doesn't prevent a pandemic. It doesn't prevent you from spreading the virus. Even if you do fare well against the coronavirus because you are healthy, it doesn't diminish your ability to pass it on, like the vaccine diminishes the ability to infect the person next to you and the people that you love. So even if your immune system is A1 and good to go, it also doesn't mean that you're not going to get infected by the coronavirus. We know that at least 10% of people who are hospitalized don't have any pre-existing conditions. So to me, it's like playing Russian roulette. You just don't know. Still go ahead and do it. Still go ahead and try to optimize your weight, optimize your vitamin D level, take your zinc, take your echinacea. I don't have any problems with that. I do it myself. But I also am not under any pretext that alone would A, protect me from a severe infection of COVID, or B, prevent me from passing it to people who I love and whose lives I cherish.
Mm-hmm.
Wow.
All
right.
We're gonna come back to the comment. Well, I mean, we could go stay in the comments because the comments are on fuego tonight. They're on fire, which is great. We love you guys, and we thank you for being here with us.
You all.
We love you all.
Well, let's talk about the doctor. I think he was in Alabama who said he wasn't going to see patients in his practice who were not vaccinated. What y'all think about that?
This is where Lila goes against what y'all think Lila's going to say. I do not agree. If he is there to serve and treat the community, I feel like that's what he should be doing.
Okay.
So I feel some kind of way about that.
Okay. I hear you. What do you think, Wayne?
Well, I mean, doctors, so where does it stop? So we just discussed this 3 weeks ago or 3 or 4 weeks ago when we had Daniel and Dr. Biggers on the show with the LGBTQIA situation where doctors didn't want to treat them for morality reasons.
Right.
So what does the Hippocratic Oath say? What does that say, Dr. Mel?
Well, it says, do no harm, right? That's the bottom line of, you don't want to make a situation worse. You do not want to harm the people that you're supposed to be helping. And I hear what you're saying. I think there are two sides to it, though. I understand the side from his perspective where he's saying, look, I'm not denying people emergency care. I have a private practice. That's the key word, a private practice. And I can say, who I will treat and who I won't treat. And this is a decision based not on morality, but on medical reasons. He may be saying, look, I don't want to treat unvaccinated people because I know that I'll be at a higher risk by exposing myself to them.
Mhm.
And they are making a choice for themselves that they believe is true. And I'm making a choice for myself that I don't want to surround myself with unvaccinated people in my practice. And he also might be looking at the fact that his colleagues who are hospital based are woe out, which is the level beyond war out.
It's a technical term.
Yes, it's the technical term. You know, they've been seeing wave after wave after wave of COVID patients come in unvaccinated, begging for the vaccine, even as they're being intubated, not understanding that it's not a treatment. You had to have taken it when you were well. And, you know, he's doing it to influence the choices of his patients. So he's saying that since he posted that sign, 3 of his patients have made the choice to get vaccinated because they want to continue with him as their primary care physician. So I get it. I get both sides, especially when you bring into the equation talking about, you know, discriminating against people based upon quote unquote moral reasons. But I think this is a medical reason, not a moral reason.
Okay. So we're going to go to the comments because comments just hopped off the chain. And I want to bring in like a comment from one of our favorite guests of the show. In this situation, I'm familiar with. Richard Goodjoin says, a physician can fire, caps, all caps, fire a patient for noncompliance. Shall I tell my story? Shall I tell my story? So, Richard Goodjoin firing a patient. I was fired by a doctor who told me to lose weight, and I lost 3 pounds, but it wasn't enough. And he didn't want, it was at the beginning of the ACA care, and he didn't want it to go on his record that he couldn't treat me. I don't know. You explained it to me, but I was hot. But he daggone sure fired me.
Yeah, it
For
can happen in there.
non-compliance.
For non-compliance. Oh, you didn't lose enough weight.
If he has counseled his patients along that same line, if he's counseled his patients and said, look, the vaccine is your best option. You have XYZ, you know, underlying health conditions, your XYZ age, you know, you have people that you live with who are vulnerable, you know, to protect you and your family. You really need to take the vaccine, and they refuse.
Put it back up.
It's a medical reason. It's not a moral reason.
A physician can fire a patient.
Thank you, Richard Goodjoin, for that
well, I don't like
reminder.
Well,
I mean, it's true though. It is true.
Oh, Lila, I was hot. Oh, I lit up his office. I was hot. How dare you fire me? Right here in front of my face. You could have fired me in an email, on the phone. He fired me in my face. Yeah, I won't be able to treat you any longer. Here's a doctor that can.
Oh. Okay, Wayne, let's get to some comments.
Oh, you want to get some comments? Oh, y'all don't want to hear me anymore. Okay, let's go to the comments. Yvonne says, this is different, Wayne. E-visits are available. So what you think about that, Dr. Mel?
E-visits for
the doctor could do
as an alternative.
Mm-hmm.
Yeah, but again, that is an alternative, but not everything can be taken care of in an e-visit. Number one.
Labs.
Yeah, exactly. Labs, prostate exams, breast exams. You know, there are a whole host of things that you really need to examine the person and put hands on them. And so, you know, those situations are going to eventually come up. And so e-visits aren't a long-term solution.
E-visits aren't a long-term solution. And we say, somebody mentioned a pastor up here. Oh, didn't a preacher say that she wasn't going to pray for the unvaccinated person who has COVID? I don't know.
I don't know. Now, see, for me, that draws the line. Like, how you going
That
Jesus
draws
said,
the
"Love
line?
everybody, even the lepers." I mean, how you gonna not pray for people who are vaccinated who
How
get
you going to
COVID?
not
That's
pray?
messed up.
How you not going to have compassion
That's
for
the
somebody?
same to me. That's the same to
No, but it's
me.
different. He's not saying that he's not going to treat patients who with COVID. He's saying if you are one of his regular patients who he sees for preventive visits and whatever comes up in your life, he will refer you to another physician, but you're no longer part of his practice if you're not unvaccinated. That's different than a situation where somebody is dying or has some kind of situation going on, and they go to a hospital and they're denied care. That would be the parallel to a preacher not praying for somebody with COVID. To me, they're different.
I need more.
They're different.
They're the same to me. I need more context. Is he saying he's not gonna lay hands on? He's not gonna pray for him in person? Like, what does that mean? That I don't understand that. Because he might say, "You can't come to my church. I'm not gonna pray for you in person." But
well, like somebody said, let's go to also everybody is great in the comments. I'm going to go to a comment by Ellen Claire Lamb, and she says they don't grant organ transplants to active abusers of drugs and alcohol. If hospital beds are limited, it's hard to say that those should go to unvaccinated patients when vaccinated patients need them. But that is a slippery slope.
Ooh, it is.
Yeah, there was actually an article. Thank you, Ellen, for bringing that up. There was an article today about the rationing of hospital beds and who should get them first, vaccinated people or unvaccinated people. Again, I do really think that is a slippery slope. I think, gosh, I hear what you're saying about the organ transplants. I still think it should be a first come, first served basis, because if that person does survive COVID, they will have antibodies. They will have immunity. So that is essentially their vaccine, as opposed to the concern about giving an organ transplant to an active abuser. They're going to go out and basically destroy the organ from continued active abuse. So it's not exactly a 1-to-1 correlation. So yeah, I know there were arguments either both ways. I think I would kind of come down on the side of treating people first come, first serve.
Well, Dr. Mel, what about insurance companies passing the cost on the unvaccinated?
Yeah, all kinds of things popping off. Yeah, so some insurance companies are now taking a hard line. Like, if you're not vaccinated and you get COVID, we're not going to cover your bill.
Eek.
That's a tough one too.
Because up until now, COVID has been free.
Right.
So they're saying they're going to extend that. That was a special dispensation because we were in a pandemic, and they're saying that they're going to continue to extend that courtesy, if you will, to people who are vaccinated, but not to people who are unvaccinated.
Okay.
They're just going to treat it like any other disease. So it's not like they're going to charge you full price, but they'll start to charge the co-pays and the co-insurance and all the other, your deductible. See, all those things weren't necessarily charged before.
Okay.
Got it. Okay. That's clear. I want to say this about hospital beds. All of y'all out there doing this daggone crate challenge and busting your head on this crate challenge, knock that off, okay? There's people out here who getting COVID who need beds. All right.
Oh my God, that looks
Please stop.
insane.
It's not funny.
I mean, I can't imagine the head injuries and the back injuries and the rib injuries and the broken arms and ankles. I mean, I just can't imagine. And like you said, beds are full. Doctors, have their hands full treating these COVID patients, plus all the other serious injuries, without people going out and creating situations where they have to end up in the hospital. It's crazy.
So, I see all the comments from all the programs, right? So this is the heavy part comes in. And we take all comments. We don't show all comments, but sometimes we show comments even we don't agree with. Somebody said, What's funny about this segment, meaning the last segment about doctors getting fired, the funny part was I actually got fired. So it
He
was
was the
funny
one
to
who got
me.
fired.
And I was, so let me explain to you. So that was funny to me. I made fun of it. And then the person says, I've watched several of your segments, and there never seems to be any real deep diving, always superficial and not the least bit helpful or informative. Do better.
But you keep coming back, so that's awesome.
Yeah,
So you've
thanks for
watched
tuning
several
in.
segments. Thanks for joining and
So,
watching.
so if you could join again and watch and see if we go deeper into and see if we can do better. Help us, send us comments on
Yeah,
how we
send us
could do
some
better.
comments. We appreciate
How
that.
we could do better. I mean, we're down for. I mean, hey,
Yeah. So moving right along, there was one
right.
other thing that I wanted to bring up about, Reverend Jesse Jackson is in the hospital, as is his wife, Mrs.
Yeah.
Jackson.
Wow.
Very sad. I'm, definitely sending prayers out to their family, and to them, that they will have a speedy recovery. I think they put out a press statement tonight that they are responding to therapy, so that's a blessing.
That's a
Yes,
blessing.
And
it
I
is.
should say they're hospitalized because of COVID.
Wow.
And sounds like one person had the vaccine and the other one did not.
Right. Reverend Jackson very publicly took the vaccine back in January. And so, as we've been hearing about boosters, especially for older people and people with low immune systems, that after about 6 to 8 months, they're seeing immunity wane in some people, which is why the whole discussion about the need for boosters now. So, he clearly might be in one of those 10, the vaccine is not, the Pfizer vaccine is 90% effective in keeping people out of the hospital, which means that 10% of the people might end up in the hospital. So clearly, he's taken the vaccine and he might be one of those 10%. And his wife is unvaccinated. So we know that 98% of people in hospitals right now with COVID are in the unvaccinated category.
I would love to hear from our audience in the comments how many of you are married and or living with your partner and or roommate, and one person or some of the household is vaccinated and some of them are not. I just wonder how that's
Adults, because
reconciled.
adults were not vaccinated, because
Adults,
we know
right.
kids under 11 can't be vaccinated.
Yeah. I'm
Yeah.
curious about what those conversations are
How does that
like.
work?
Yeah, in the house. That's
Yeah.
a real question.
Because clearly that was what was happening in the Jackson household. And while we're waiting
Right.
for people to put comments in, I just wanted to point out, that 50% of the country is vaccinated, roughly, and 50% is unvaccinated. It's really more like 52% vaccinated, 48% unvaccinated, but roughly even. Yet, 98% of the people in the hospital are unvaccinated. So it's almost like an
Right.
apples to apples comparison. And then you see who's in the hospital with COVID. So even though there are a small number of breakthrough infections, you know, overwhelmingly, getting vaccinated is helping 90% of the people stay healthy who get vaccinated, whereas the unvaccinated are just sort of out there hoping for the best.
Yeah.
Wow. So, look, we got to mention something. I mean, people, it's 20, not quite 20, but it's about 10 people who've mentioned this drug. Let's go to Marv West. Have you ever treated a patient who used horse and cow medicines such as
This is
ivermectin, the anti-worming product?
it's a
Somebody else,
thing.
it's a thing now. I thought,
Yeah, so let's be clear. Well, let's take a step back. So ivermectin is a medication that is used in humans. It is used to treat parasites. However, the version of ivermectin that people can get their hands on without a prescription is the veterinary product that is used to treat cows and horses. So, because of the social media fueling that's been happening around taking ivermectin, just like, a year ago, it was hydroxychloroquine was the sort
Mhm.
of on the street drug for COVID. Ivermectin is now on the street drug for COVID. And so people don't realize that there are these two versions of them. So they're taking the veterinary dose of ivermectin and they're ending up sick. Understand, though, that there are clinical trials that are looking at ivermectin as prophylaxis and ivermectin as treatment, but there is no data to date that shows that it is effective, from a really well done large scale clinical trial. So that being said, if you're in a clinical trial and you're taking ivermectin and it's under the supervision of a physician, fine. If you're going to the barn to steal your horses and your cows ivermectin, that's not a good idea. You will end up sick.
That's pretty much you're going to end up sick. For the black market, do we even say the off market
Right.
ivermectin user?
Right. And it's ironic, again, taking a medicine that hasn't been studied for this purpose and
Right.
feeling that it's safe to take, and nobody really knows, the lay public doesn't know what's in ivermectin, versus the vaccine that has been, studied by multiple countries, multiple companies, taken by over 180 million people in just the United States, as opposed to, millions more worldwide. Overwhelmingly safe and effective, studied for this particular purpose, but is being rejected by the people who embrace ivermectin. It's kind of hard to understand.
It is. It
Okay.
is. It's difficult to
Okay.
reconcile.
So let's go to a few comments. Yvonne Z gets on again. She always has a great take.
Hi, Yvonne.
Wayne, I say my name wrong. I must be on vacation. I said wine. That's where my head is. Wayne and Lila, I talk to every day. I talk every day to people in split households. Mothers and grandmothers are struggling to convince black young men. The next one is Vera Evans Grant. Oh, my husband's cousin's family are all not vaccinated. 3 hospitalized, 1 died yesterday morning.
So sorry.
Our prayers go out to you, Vera.
And I just want to be clear, Vera is my cousin. So hi, cousin Vera.
Hi, cousin
Thank you for
Vera.
watching, and please give my condolences to your husband and his family.
Right. We got Tiana Turner. My whole family is vaccinated and I am breastfeeding. Was really scared, but I know had to protect me and my family. That's a good take. That's very good. And I have no other people who are split in there. Okay. So we have a lot of interesting questions. People want to know what's in the jabs. Why do they call it jabs? If y'all could explain that to me, I just don't know.
I think it's the jabbing motion. But anyway,
okay. Yeah.
So what's in it? So for the Pfizer and Moderna vaccine, it's messenger RNA. What's that? It's the blueprint or the sewing pattern for making the spike protein, right? Messenger RNA is something that is in our bodies already. We have our own messenger RNA. The virus has its own messenger RNA, and it is common that our cells, when we get infected by a cold or a flu virus or a stomach virus, that our bodies are exposed to viral messenger RNA, because that's how the virus gives instructions and hijacks our body's mechanism to make more virus. So it uses our cells to make more virus. So the vaccine is just mimicking what happens naturally. So it's taking that viral messenger RNA, but just a small piece of it that makes a small piece of the virus, just enough to give our bodies the information that it needs to then make the spike protein and our bodies have the response to the spike protein of producing antibodies, so that if we do get exposed to the coronavirus for real, then we will have the antibodies on the ready, already mobilized to take it out. So, in order for that messenger RNA to get into the body undetected, it is wrapped in a fat droplet. That fat droplet is then stabilized with sugar and salt. And that's what's in the vaccine. That's it. You can go to the FDA's website to see the actual, chemical names of the fat, the sugar, and the salt. But that's essentially what's in the vaccine.
And there you have it. Oh, I just found out jabs are what they call shots in some European countries. Thank you.
Okay.
Okay.
Somebody posted. We've learned. The doctor explains it very clearly.
She does.
She does.
Thank you.
And they say, what about the other ingredients? That's it.
That's it. It's the messenger RNA, the fat droplet, and the sugar and salt to stabilize the fat droplet so that it can get into the cell, so it can get into the body. Once it gets to the cell, the fat droplet disintegrates, the messenger RNA enters your cell, and it stays in the outer section of the cell. It doesn't go into the little inner chamber where your DNA is. They never, ever interact. And then within minutes, the messenger RNA is destroyed. So I use the analogy that the fat droplet is the Uber driver that drops the mRNA off at the apartment building. The mRNA goes in, the spike protein gets made in the lobby, and there's no way that it can get into your locked apartment where your DNA is. And then in minutes, building security arrives and takes out the messenger RNA and destroys it.
Okay. There we go.
What y'all think is in it?
Yeah, what do y'all want to be in it?
What do y'all think is in it?
There's no microchip. There's no 5G. And the word nanoparticle, the Greek for little, is the word nano. So nanoparticle just means little particle. That's all it means, because all of this is done at a very microscopic level. So everything is a nanoparticle at that level. It doesn't mean something evil or, I keep thinking Dr. Evil. It doesn't mean anything like that. It just means that everything is being done at a microscopic level. It's the same technology. Nanotechnology is the same technology that allows a computer, a room full of computing information to now be contained in our smartphones, right? Yep. It's a nano chip that stores all that information that allows your smartphone to work. So it's the same basic idea. Nothing scary about nanoparticles.
Somebody said ethanol in the J&J.
Yeah, it's I don't know that there's ethanol in the J&J, but anything that ends in OL is either a sugar that, like I said, that's used as a stabilizer. Sucrose is actually in it. That's one of the sugars that it's in it. I don't know that ethanol is in the J&J, honestly.
Mm-hmm.
Actually, what's in the J&J is the viral DNA, again, that same blueprint information to make the spike protein, but it's surrounded by a virus. And that virus is called an adenovirus. It's the virus that causes the common cold, and it's been killed or deactivated so that it can't cause an infection. And they kind of use that virus as the Uber driver to get it into your body and to take it to the cell, where then the adenovirus outer layer is destroyed, and then the DNA enters your cell, same thing, hangs out in the lobby, is used to make the spike protein, and then building security comes along and destroys it within a matter of minutes.
Okay. So Lala Superville, we get it. You're posting all the ingredients for the J&J, or we get it. So no live virus in the J&J.
Right.
and you heard what's in Pfizer and Moderna. Okay.
Right.
Somebody asked, what's in bacon? What's in weed? What's in
Pig
these
D.
are real
I tell you,
things.
pig
Like,
DNA and
like
pig messenger RNA is
they're
in
just
bacon.
like, yo, why are you asking that question? What's in bacon? What's in weed? Do you know? Anyway, what's
Same.
What's in
same thing? We
Viagra?
get what's in Viagra? Very same thing. You know, be careful. Oh, update from Vera. She said her mother-in-law is vaccinated, and since her mother-in-law's cousin died, her father-in-law is now agreed to take the
Oh,
vaccination.
great.
So,
Wow.
Well, it's for every cloud there is a silver lining. So we hope that's
Yeah.
a silver lining for you, Vera.
So Ellen Claire Lamb had a question about why the vaccine has to remain cold. Is it because because of the fat droplet?
Yes, so that it doesn't disintegrate and destabilize, and it remains intact long enough to get into your body.
Okay.
Okay.
So look, we have several questions about booster shots.
Yes. Yeah, we got to talk about that. So,
Yeah.
um, what's been seen over the past few months, roughly 8 months, is that immunity starts to wane. And, at 6 months, they came out and they gave information that looks like immunity looks great. Well, in the intervening 2 months, it looks like it started to wane. They've looked at studies out of Israel, and then they looked at 3 studies here that showed that the vaccine's effectiveness dropped from about 75% to 53% between May 9th and August 1st, essentially. And what happened during that period? The Delta variant came
Right.
along. So the effectiveness against the Delta variant in producing symptoms and breakthrough infections is what it is, not necessarily hospitalization. So what we're seeing is that the hospitalization rate fell from 95% down to 90 or 91%. So it's still very effective in preventing hospitalizations. So we know for sure that people with low immune systems, for whatever reason, medications, cancer, HIV, that those individuals need a booster. And so the FDA approved boosters for individuals with low immune systems. That happened last week. Then the CDC has come along and said, well, we're now actually recommending boosters for everybody. So the FDA has to go back and review that same data and decide, based upon the information submitted, should we recommend or should we approve boosters for everyone? And if they do so, it would be starting at 8 months after your last dose. So those people who were first in line to get the dose, essentially healthcare workers and the elderly, would be first in line to get the boosters, which would start sometime around the end of September. But again, we need to wait and see if that happens. There was also another study that they looked at, which was data from New York State from May 3rd to July 25th, which, as the Delta variant grew to more than 80% of the cases, again, they saw the effectiveness of the vaccine decline from 91% down to 79% during that period. So again, that was a drop in preventing symptoms, not in preventing hospitalizations. And interestingly enough, the other thing I just wanted to add is that in Israel, they saw that the hospitalizations of vaccinated people occurred mostly in people over 65. Sorry, not hospitalizations, the breakthrough infections, which just means symptoms, occurred mainly in 65-year-olds. Here in this country, we're seeing it occur mainly in 18 to 49-year-olds, and that's probably because of behavior, because those are the individuals who are, most likely to be out and about and living their best lives. I'm vaccinated now. I want to get back to life as normal. And, there was that whole period where we were told it was okay to not wear a mask because the Delta variant wasn't yet prevalent. But now that it is, and we need to go back to wearing masks, there's a lag in people it's hard to go back. It's harder to go backward than had they just said wear the mask the whole time. But of course, hindsight is 2020.
Yeah.
Wow. So we have a couple questions, and actually a statement. Where is it from? Joyo. I won't say your real name. We know Joyo. Joyo. I received the Pfizer vaccine, but plan to get the Moderna vaccine when it's time to get a booster. Can you talk about mixing the boosters?
Yeah. Hi, Joyo. So the the CDC said back in January that it's okay to take a Moderna booster if you had Pfizer and vice versa, uh, if there's no other option, right? So in other words, it's not harmful, but they kind of really don't want you to do it because it hasn't really been studied.
Hmm.
Now, if you go over across the pond over to Europe, they've been doing it for a long time and think nothing of it. Many countries, are mixing and matching vaccines, but the only one that's really been studied is people who got vaccinated with AstraZeneca later getting Pfizer. And what it shows is that you actually have a better immune response when you mix and match, because it's like presenting sort of a different take on the situation to your immune system, so you develop a broader amount of immunity. So I don't think that it's going to turn out that there's anything wrong with it. The Europeans certainly have not had any issues with it, but just know that it hasn't been studied to say that it's 100% okay.
And Belinda Francois says, Lord, what's going to happen if another variant comes along and a breakthrough happens then? How many more boosters therein after?
We don't know. This is our first time through a global pandemic in 100 years. And I think what is very important to know is that, scientists don't have all the answers. And scientists and doctors are studying things and trying to keep ahead of the problem before it gets to be a problem, which is why they're recommending boosters at this point when the vaccine is still 90% effective against hospitalizations. They're saying, hey, look, before this situation potentially gets worse and other strains come along, let's go ahead and get out in front of it and boost immunity even more by using a booster. Against all the known strains right now, the vaccines have been overwhelmingly effective. But we can't look into the future, and nobody has a crystal ball. And I think that's really important for everyone to think of and remember out there. When you hear guidance from the CDC, understand that it's the best that they know today, and that everybody has to stay vigilant and stay listening, because as the situation changes, they're going to update and give you the best information that they have for that time, because it's the first time any of us are going through a pandemic like this.
I think that's been used against the CDC, that they changed information.
Oh, for sure.
Yeah.
Yeah. Well, they have, but that's because the situation has changed.
Right.
I heard a great analogy. When you take off in an airplane and you get to 10,000 feet, they tell you could take off your seatbelt and move around the cabin. But if they hit turbulence, they tell you sit down and put your seatbelt back on until the turbulence goes away. And then they'll come back on and tell you take your seatbelt on. It changes. But nobody complains on the airplane like, oh, well, you lied to me and you told me I could take my seatbelt off.
That's great.
This is a changing, evolving situation, and we have to change and evolve with it. And the last time the dinosaurs voted not to change, I'll let y'all fill in that.
They not here
Put
no
two
more.
and two together.
They not here no more.
Right. We gotta stay fluid, y'all. We just gotta stay fluid.
Before we run out of time, schools are reopening. So, what does all of this mean for the kids?
Well, a study came out this week that definitively shows kids spread COVID.
Yep.
And so in a school situation where we have this governor down in Florida who's, fighting tooth and nail against mask mandates, it's just illogical. Why not allow the children to protect themselves, those around them, and those that they have to go home to by wearing masks, especially since they don't have the option of getting vaccinated? It just
I don't
doesn't make
understand it.
sense. And we already know, I think something like over 20,000 kids in Florida are quarantining now after the first week of school. And that's been repeated in state after state after state. Just huge numbers of children getting exposed to COVID and having to quarantine.
Mhm.
You know, just wear a mask. It's not that big a
It,
deal.
it's the least
Yeah,
you can do.
It's
exactly.
it's actually, so in the comments we have one person says if it's not safe for kids uh under 12, if it hasn't been proven for kids under 12, why are they trying to convince pregnant mothers to get it? And I would reference that person back to our previous show on pregnancy, because unless Dr. Mel wants to cover it, I don't think she does though.
No, I mean, they have, first of all, the mechanism is different between a fetus that's inside of a mother versus um, an individual who's out on their own. So I just, wanted to be clear about that. There is a difference. Number two, there have been over 150,000 women who are pregnant who have been vaccinated and have been reporting to the VAERS database and the VSafe database. And there's been no reports of an increased incidence over baseline of the number of miscarriages or other pregnancy complications as a result of the vaccine. So that's why. And also, the last thing is pregnant women are at increased risk for COVID. The ICUs now have many, many pregnant women in them because pregnancy in and of itself is a risk factor for getting severe COVID. And so it's really important to protect pregnant women and their babies, because if they get sick, their babies might not make it. And so the vaccine has been shown to keep pregnant women out of the hospital and having and so that they can go on and have successful pregnancies.
Okay.
Yeah.
Yeah.
All right.
Looking at
Well,
Maroli, it's about that
About
time.
that.
yes. Well, I want to thank you guys again for coming in off the beach. You probably have some sand on your toes for coming in on vacation time, but there was just so much to talk to, and I know people were going to have questions. And so I want to thank the audience for joining, for all your questions and comments, whether they agree with us or not. We appreciate your participation. We appreciate your listening. For those who are free tomorrow morning at 7:45 a.m., I'll be on the Russ Parr Morning Show, which is a Radio 1 station in the markets where it is. So feel free to listen into that. Please remember to be safe out there, to wear your mask, to wash your hands, to practice social distancing. It's COVID 2021 now with this Delta variant, and it's on and popping, and we have to do everything to be safe, including getting vaccinated. So thanks for tuning in. Remember, until I see you again, be wise, be well, and be health empowered. Thanks so much for joining.